You're watching the Microsoft US Health and Life Sciences Confessions of Health Geeks podcast, a show that offers industry insight from the health geeks and data freaks of the US Health and Life Sciences industry team. I'm your host, Claire Bonacy. On this episode, we celebrate National Physicians Day with a special podcast with Dr. Clifford Goldsmith, our US Chief Medical Officer. Clifford shares his unique journey that led him to become a doctor and discusses the importance of technology for physicians. Hi, Clifford, and welcome to the podcast.
Thanks, Claire. Nice to be with you.
Yeah, so you have been at Microsoft for quite some time now, around 21-ish years, but you were also a practicing physician for a long time before joining Microsoft. Do you mind giving us a little bit of background about why you became a doctor in the first place?
Well, I think it was a calling, in a sense that I wanted to help patients. It was very much a feeling that I wanted to be able to make a difference and for individual patients. And as I studied medicine and went through medical school, I actually became interested in community health as well. And growing up in South Africa under apartheid, it became very obvious, something that is fairly obvious to us today here after seeing health inequities in the US. Those were just as obvious, during apartheid, where you could see that inequity. And so I started to get interested in community health as well. And so that it was really around doing the right thing for people and for populations or groups of people.
And so you did mention the apartheid briefly. I heard through the grapevine that you kind of had some underground hospitals during that time. Can you explain a little bit more about that?
Sure, I'd be happy to. So as you probably, or people know, Nelson Mandela headed up the African National Congress, which was the leading opposition to apartheid. And for the work that he did and many others did, they were jailed. Many people were jailed. He was jailed for 27 years on Robben Island. But even as he was jailed on Robben Island, he was still able to influence what was going on. And so in the country. And he did this in this case. So we got approached, a group of us that were in fifth year medical school at the time, were involved in the anti-apartheid movement, but hadn't done much in terms of healthcare. And we got approached by someone who had spent 5 years on Robben Island in direct contact with Nelson Mandela. And he came to us and he said, one of the things that Nelson Mandela feels is necessary is that people in South Africa were being victimized after they had protested. And the way this was happening was that the government was shooting rubber bullets, shooting real bullets, but spraying a dye, pretty much like the mace dyes that we see here today. And that dye was on their skin and identified. And then they would send policemen or agents to the hospitals, the local hospitals, to put into jail anyone who came in with an injury that had this purple or whatever color dye was on at the time. And so people were afraid to go to hospitals. And we discovered this through Nelson Mandela indirectly, but then we were also shown by an internal wing of the ANC, the United Democratic Front. We were taken to churches in Black communities and shown what was really happening. And I was horrified. I have to tell you, I vividly remember a 21-year-old woman who had an open chest wound and had an open chest wound with a collapsed lung for 7 days, and she was so afraid to go to the hospital because she knew she'd be arrested. So what we did is we started an underground system that would, when somebody was injured and needed care like that, they could call a triage center, and the triage center then would make sure that they could be taken out of that community to a different community where there wouldn't have been oversight over the hospitals. So that was essentially what we did, and we created a fairly extensive underground health system that led to, unfortunately, some of the doctors being killed off by the police as well. The person who was triaging the calls was killed by the police. And so it was in that period that I left. There was also a movie that was done, and I agreed to be part of that movie if the movie was only released after I'd left South Africa. And so in 1986, the movie was released. It's called Witness to Apartheid.
Wow, that really is amazing. What was kind of the reason for you to stop practicing medicine, or was it to just go to the US and leave that behind?
Yeah, so the main reason was to leave South Africa. I had to leave. There were other reasons I had to leave as well. I tried. Well, let me go back one step. So even after all of that, I tried really hard to stay in South Africa, but there was compulsory conscription, and every white male had to spend 2 years in the army defending the country. I was able to defer that when I started medical school, as many doctors did, because they wanted doctors in the army. And so I deferred the I deferred the army. But when I finished medical school, I immediately got conscripted into the army. And unfortunately, someone who had been an opponent of mine in political circles, who was a right-wing medical student who had led the pro-apartheid movement on my campus, knew me. He had now become a colonel and a surgeon in the army, and he used that opportunity to really to exact sort of what he thought was a form of punishment on me. And so I got sent into the very front lines of the pro-apartheid army, fighting against Southwest African People's Organization, which is an organization in Namibia, in previously Southwest Africa. And that was traumatic. That was incredibly traumatic. I was put on foot with reconnaissance mercenaries, and it wasn't something I ever would have wanted to do in my wildest dreams. And so I landed up having to. It was at that time that I made the decision that I needed to leave, and so I deferred the second year of my army, specialized in order to specialize, which they allowed me to do, and in the process of specializing, made plans to come to the US, and so that's why I came here.
Wow, that is an amazing story. Would have never guessed that, to be honest. And so if you had qualified in the US to continue practicing medicine, is that something you would have wanted to do? It sounds like you had such an arc of practicing medicine and seeing such horrible things. Is that something that you wanted to continue, or were you really looking into moving to do something more in a technology company?
As you know, as horrible as it was in South Africa and the trauma that I saw, there was some sense of satisfaction, if you want, or sense of gratefulness that I was able to help. And so it was a really good, hard to say this, but it was a really good experience. And I've got many sort of vivid memories, not just of the people that we helped through the underground health system for emergency health system, but even in the army, there was some sense of helping people in Angola, where I was placed outside of Southwest Africa, that was also quite rewarding. I think I had finished specializing, and so I was a pulmonologist by then. Came to the US, and unfortunately, unfortunately, wanted to live in Massachusetts, and there are only some states that required that I go all the way back and redo my internship as well as my specialization. And I'd already become very interested in technology. In fact, while I was doing my residency, called a registrarship in South Africa, I worked in technology. I got trained in computer programming. I loved computer programming. And it was through computer programming that I got my first job in America. I needed a job right away, and I got a job at Harvard Medical School and the two hospitals that worked in their hospital systems, the Beth Israel and the Brigham and Women's Hospital. And it was through that group, the Center for Clinical Computing, that I became really, really interested in technology. If you ask me today, I would have loved to, and I would still love to have been able to practice a limited amount, as I see many of my informaticist physician colleagues doing. I would have liked to practice, a day a week, 2 days a week, and worked in technology as I do, which I love and enjoy, 3 to 4 days a week.
Interesting. Well, that's great. And Microsoft, we're very lucky to have someone of your background and your experience here. And I know I feel very lucky to work with you every day. I'm curious, so have you been in contact with the doctors that you had worked with there, or how was the relationship after you went to the US and left a lot of those people there?
It was a very hard time coming to the US from that perspective. I mean, I always loved what America offered. I loved the opportunity offered. I loved the innovation and the creativity in the US. And so I've never, ever turned back on that. But when Nelson Mandela was released, so I left South Africa in 1986. Nelson Mandela was released in 1990. He became the Prime Minister of South Africa, the President of South Africa, actually, in 1994. That was a very hard day for me, because it happened that exactly on the same day that he was inaugurated as the new president of South Africa, I was also made a permanent resident. I mean, I received my US citizenship. And it's a hard day, because the realization that what we'd been fighting for came about. And so, my friends, many of my friends were able to stay through that. Some have gone back that I know, some didn't, but some of them have gone back and played a very significant role in the new health system in South Africa. And it's a great system. It's a system that really views health equity at its core, which is cool.
That's really interesting. I'm glad you kind of stayed part of that as well. So given that you have seen both worlds of being a practicing physician and on the technology side of healthcare, what do you think the role of technology is to a doctor who is so focused on the patient, 100% of the time?
So I actually think that our role as technologists, I feel just as good making technology that helps other doctors do their job as I did as a doctor in a way. In fact, I consider my approach to informatics as part of the Hippocratic Oath. And the Hippocratic Oath that we all took in medical school was to do the right thing for patients and for populations. Today, I mean, I'm adding populations. In the early days, it was really focused on the individual patient. And so it was really exciting. And I've just written a blog about this for Doctors' Day. It was really exciting to do things like when I read the Institute of Medicine reports in 1999 and 2001, which was the second part of that report, was called Crossing the Chasm. It pointed out how technology could improve patient safety. And it was incredibly exciting to read that. And then it was incredibly exciting to spend the next 10 years implementing physician order entry, because we knew that physician order entry was going to make prescribing more accurate and patients safer. And that was the joy of it. What I do worry about today, and in the last 10 years, is we've heard about physician burnout. We've heard about physician dissatisfaction. In fact, if you remember, there was this quadruple A, the triple aim, which came from the Institute of Health Improvement, IHI. And the triple aim was about better care, better health at a lower cost. But no one thought about the fact that as you use technology to do that, you were going to create the possibility, which unfortunately sometimes happened, of dissatisfaction or burnout among clinicians, physicians and nurses. And so it's quite disappointing that our technology has led or is bearing the brunt in some cases of this feeling of alienation that doctors have. And so what would I like to do? I'd like to make sure right now that technology gets back to the point where it's actually empowering and not alienating doctors and nurses. And I think that's, certainly we've seen that in many industries. And I think that healthcare is on the cusp. And I'm very excited about what Microsoft's doing around the Microsoft Cloud for Healthcare, because I think that's our opportunity to really to put physicians back in a position where they feel productive, they feel empowered, and they feel grateful for how technology is letting them practice what they love doing, which is caring for patients.
Well, I 100% agree. I think you really hit the nail on the head around just that physicians and nurses, they are so burdened with having to do everything. And whether they have the technology to do that, it's still a burden and the curve to learn that, to implement it, and to, of course, be there for the patient 100% as well. So definitely anything that Microsoft and other technology companies can do to help that, I think that's our end goal overall. And so to end this podcast, I just want to say thank you again, Dr. Goldsmith, for being on the podcast and for sharing your story, and happy National Physicians Day.
Thank you, Claire. Thank you so much for the opportunity to do this. And thanks for all you do. These podcasts that you've done over the last year or more have been wonderful. So thank you.
Of course. Thank you all for watching. Please feel free to leave us questions or comments below, and check back soon for more content from the HLS industry team.